So, right. So today is Breast Cancer Awareness Day, and we have two lovely guests with us in Trinidad. Cheryl Reyes, who I've known for a very, very long time, too long to mention, and her friend Verna Edwards. And thank you for giving up your time to talk to us about breast cancer. I'm going to pass on to yourselves in a minute, but just to say, well, I'm interested in all healthcare topics, to be honest. But sadly, recently, we had a very close friend who, didn't, after battling, breast cancer, didn't make it, but she battled it for 6 years. But so I'm very close to the topic, and I think any information we can, talk about and share about this important topic would be very helpful to me. So on the call, as I said, we have people, just briefly before we go to you, Verna and Cheryl. Caroline, do you just want to say something, who you are, just to say your name and where you are in London?
Hi, I'm Caroline Murray, and I am the mental health trustee for TUF, and I'm a nurse by background, but I currently work in commissioning for learning disabilities and autism, and obviously, like most people, have been affected by cancer and breast cancers. Know people. So yeah.
Okay, thank you, Caroline. Jeanette, do you just want to say something about yourself and where you are?
Yeah, well, I'm Jeanette. I used to be a health visitor for many years, but I'm retired now. I'm in London as well, but I'm interested in all public health issues because that used to be my role throughout my nursing career. So I would like, and I haven't experienced it myself, but I know of people who have experiences and have a little bit of knowledge about it as well.
Sure. Thank you, Jeanette. And Alison.
I'm Alison Williams, retired nurse and midwife. And I have an interest in breast cancer. My mother died from the complications of, so it's very close to my heart. And she was in New York, so the treatment and the care is very different.
Right.
From my observation at the time, she's died a long time now.
Right.
But it's always close to my heart, and concerning that it's a family thing, because my sister had it too.
Right. Okay, thank you. And Trisha? Oh, Trisha may be away. Oh, hi, Trisha. You're on mute, Trisha. Yes?
Can you hear me at all?
Yes, yeah, I can hear you now. Yeah.
Yeah, because I wasn't on mute. Hi, good evening, everyone. My name is Trisha. I function as the secretary to TUF board, and I am also a breast cancer survivor. So I'm quite interested in hearing your stories, and if there's a way that we can support each other on this pathway, then of course. Okay, so I'm looking forward to this evening's discussion.
Thank you. Luna and Cheryl, can you hear us?
Yes.
Yes. Okay, fine. I don't think I've missed anyone else. Is there someone on an iPhone 5? Cheryl, is it you separately on another phone?
Yes, the phone
okay,
was just
don't
off,
worry,
so
don't worry. Okay, now,
yeah.
no, that's fine. So now is the big time. So it's over to you, Cheryl and Verna. This is for you to tell us a bit about your background and your journey, really, through your breast cancer story. So let's start with you, Verna.
Okay, good afternoon to everybody who's present on this show. My name is Verna Edwards, as he mentioned. 63 years of old, and I have been a nurse, former athlete. I'm still competing in table tennis. I'm a national track and field coach as well. I'm a mother of four. I was five-time national table tennis champion of Trinidad and Tobago.
Oh,
That I still play. I have two world championship under my belt in the senior division where I compete regularly in the US and on the world stage. I'm an international umpire.
wow.
And this cancer seemed to want to put a stop to my career, but I am fighting it. In no way I'm going to give in on it. I was diagnosed with breast cancer, stage 2 breast cancer in 2016. And that has been an up and down journey for me, but I can't say that I am completely cured of it, which I don't think you can, but I'm still alive and I'm thanking God every day. Every day I can open my eyes, I can taste, I can smell, I can see, I can walk, I can talk. You know, I thank God for that.
Sorry, Verna, can I just come in a minute there?
Mhm.
What made you first become concerned that you might have breast cancer?
Okay, I had two good friends who was diagnosed with cancer. One especially, she was diagnosed with it in 2009, and she was my best friend, my work friend. We were confident, very close. And I will always ask her, I was always curious about it. I had a lumpectomy in 1985, which it was benign. And but I somewhere mentally in my mind somewhere I always thought that this thing would, you don't want to think it, but sometimes the way you feel in that area, it make you want to think that something is going on inside there.
Mm-hmm.
And it's not until April of last 2016, I was working, I work at the hospital, night duty, and I felt this sharp pain in my breast, in my chest area. And it was so sharp, it was different, it's a different pain. I went straight to the doctor, and the doctor told me it was muscle spasm because I use my right hand, I play table tennis, I coach and stuff like that. And I told him that that kind of pain could never be muscle spasm, not the kind of pain it was. Because I do massage therapy, so I have an idea of it. So, and this was in April. In May, and somehow I am thinking, I'm talking to my friends and them about this cancer thing, the one who had it, and she said, well, you had to see doctor. I said, well, I do play joke with my body. Anytime I feel anything, I will rush to the doctor about that. They always encourage me for that.
Mm-hmm.
I had a tournament in the US. I went to Las Vegas. I went to Canada first with a national team. And from there, I went across to Las Vegas. This would have been in June. And the pain had eased up. The doctor had given me tablet for that muscle spasm. And it really eased, but you could feel deep down inside the pain as if it is still there.
So sorry, Verna, sorry to interrupt. I really apologize. Other than telling you it's muscle spasm, did he do any other sort of diagnostic test to determine why that pain was so sharp?
Not at that time. Not at that time.
Okay.
It wasn't until around early July. It is playing on my mind all the time. I decided I will go to the breast specialist center. It's a all breast center. I think it's have a connection with the London Breast Cancer Society or something like that.
Okay.
And I went to there and they did a biopsy. And I went back in 2 weeks to get the results, and the results was positive. So this is early August now, 2016.
Mm-hmm.
And I said, okay, so what's our next move? It's like last week. They said, well, you have two options. One option is complete mastectomy, because they were also seeing from that biopsy, they were also seeing lymph nodes connections. Out of the 15 lymph nodes, they were seeing two had the cancer. But so I had to do an emergency thing. I said, I'm not waiting. I went to the hospital. The hospital told me not until December I will do the surgery. And I said, no, 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 no.
Right.
This thing is too far. So I
Right.
did the surgery, but they couldn't tell me the stage.
Sorry, Verna, again. So you did the surgery, but privately, or how did you manage? You got brought
No,
forward, or?
I did the surgery privately 2 weeks after the diagnosis.
Okay.
Yeah,
Because
so
the state
because
hospital was giving you a few months to have the operation.
yeah, they told me that they would do it free. I could have gotten it done freely at the hospital, but not until December.
Okay.
So I said,
Sorry,
this
Caroline.
is
Sorry. Caroline, you said something on mute. Did
Oh
you?
no, I was just wondering what month did you have it in? So you from June you went to the doctor and then July, and so you did it till around
I
August
did
then.
it on I did my surgery on the 13th of September 2016.
Okay.
Yeah, which would have been like 3 weeks after I got the diagnosis,
Okay.
because when you do the biopsy, it would take a time here.
Yeah.
You get about 3 weeks before you can get the results. And by that
Okay.
time, then you
Wow,
have to do
as
consultation and
long as
stuff.
that.
Yeah, we third world country kind of thing.
Yeah.
So with consultation and you want to get a second reference to some sort of thing. So I went to the hospital. The doctor was telling me, it's not as urgent as you think it is. So I said it was my body and I think it's
Oh,
urgent.
really? Mm.
Yeah, so I went to I did it privately. It cost me a piece of money, but my mind was still at ease,
Yeah. Yeah.
So I did a full mastectomy, because when I went to my doctor, I told him exactly what I wanted him to do. I started reading up. I went to Dr. Google and I
Mm-hmm.
started getting all the information. So
Right.
I looked at it. You're talking about lymph nodes in indulgence here. So I told him, doctor, I'm a table tennis player. As a sport that I love, it's on my right side. I want, when you're going in there to my lymph nodes, I don't want you cutting under my arm, because I know you can pull them bunch of grapes. Once you remove the breast, you can get at it. So I told him, I told him exactly what I wanted him to do, and
Oh,
he did
really?
just that. Yeah, he said, all right, doctor. So he's making fun of me now. He said, okay, doc, okay, doc, okay, doc. I said, all right. So he did that, and I was okay after that. The healing process was good. And within that healing process, I went back to the hospital, because you're talking about after treatment, what you're going to do. So he told me, you definitely will have. My surgeon told me I'm not a case for chemo or radiation. And I told him I want to go the full distance.
But did he give you a reason why that was?
Well, he was saying, everything seems so confusing, because when I got the report, the radiology report, it stated where it had chest walls interference. It was attached to the chest walls, right? So which means that it's deep. And you are telling me no chemo, no radiation. And I told him, this thing in this is song and right.
Mm.
So I went to the specialist now, the consultant at the hospital, which is very good. And he was a Cuban doctor and another Trinidadian doctor consultant. And they told me, because there is muscle indulgence and it has the cancer has invaded your chest walls, it's important that you do chemo and radiation to get rid of it.
Okay.
And
So
I
different
decided,
from what the first doctor told you, basically.
yes, but he's a surgeon and he's a breast specialist surgeon. So they are telling me now, doctors do try to get at one another, and they're telling me, okay, I want you to understand that he's your surgeon and he did what he had to do, and now he have to leave it to us, the oncologists, to do what we have to do. And it made sense. So I told him, okay, I am willing to go the full run. Burn out your hair, black up your tongue, blacken up your nails, do whatever you had to do, but you had to do what you had to do. So I did. I decided I would take the chemo. This is December now,
Mm-hmm.
because you're looking at 3 months after September, October, November, December. So they booked me to do chemo the first week in January 2017. So I am still looking at my diary, because I have a full diary. I have a tournament to go to attend to in the States in June. Then I have another big tournament
Yeah.
in November. in Las Vegas, and I have another tournament somewhere in December. So I'm looking at my schedule, and I am trying to look at my treatment.
Mm-hmm.
So I talked to my doctor, the oncologist, and say, okay, how often do I have to do this chemo? So they explain the concern. They say, you have to do it every 21 days. They prescribe 8 dosage of chemo, which is four ACT and 4 Taxol. So we just call it the pink lady here.
Mm-hmm.
All right, so I came in to do the access the day to do my bloods, and everything was good. Strange enough, everything was working good. My whole blood works, everything was perfect.
Mm-hmm.
When I went in, they said, so the doctor is giving me a lot of jokes. What? You look like a good candidate for this thing, and I'm not in any depressive mood or anything like that, because I make up my mind. This is it, and this is what I'm gonna do.
Mm-hmm.
Yes, sir. So they say you'll be all right. This is what the doctors tell me. You will be all right. So I went in and I did the first dose of chemo on the 4th of January 2017. And I am sitting there and I'm good. Taking in the thing, I'm watching it run, and I say, all right. I hear people talk about this chemo and how it is, how you upset and thing. So I am waiting for this stage to kick in. But I was okay. I had it. I went home the day. I'm looking to see when this thing will kick in, because no bad feelings. My friend told me when she did it the first day, the bad feelings didn't kick in until like about 6, 7 o'clock in the evening. So I am there looking, waiting.
Mm-hmm.
I maintained my diet. I had a lot of greens to eat. I was using a lot of greens like bhaji. We have our spinach here.
Mm-hmm.
So I am eating spinach. I didn't have the feeling for meat. So I was using a lot of juice. I was juicing a lot, beets and carrot. On the 10th day after the chemo treatment, I was feeling so good. I decided to do some work around, just after Christmas, started to do a little work around the house, and because that Christmas was a very depressing Christmas to me.
Mm-hmm.
Just knowing what you had to do.
Mm-hmm.
Chemo had to come up and all that. So it's really depressing.
Mm-hmm.
Eventually, on the 10th day, I started to get some pains. It was like sharp shooting pains in my ankles. The pain started in my ankles. Sharp shooting pains. Both ankles. And then it moved from my ankle, it shoot to my knees. But the pain removed, it just moving it. So it moved from my ankle to my knee. And it's shooting pain. And it moved from my knee to my hip. So I'm conscious of this now. So I said, let me go and bathe. And I bathe and I lie down straight on my bed. I said, well, all right. If this thing moving, if it moving so fast, I don't know where it's going to go next. So it moved from my knee to my hip, and it's just moving to the joints. And this is experience. I don't know if anybody else, because I asked my other 2 friends who were victims, and they never feel that kind of pain. And this pain moved from my hip to my neck. I tell you, when it moved, you're not feeling any more pain down in those areas where it was.
Okay.
And I am lying straight on my bed in a supine position, both hands on the side and straight. I said, well, if I had to go, I mustn't give nobody no trouble to straighten no limbs. So my
Right.
son came in the room and he said, Moms, I ain't see you. Yeah, okay. I said, boy, I getting some pains here. So I started telling him the deed here for the house, if anything, because I don't know, I prepare it.
Mm-hmm.
Eventually the pain just do so and gone. And that was it. I can't tell you how that pain feel again. It just disappeared. And that was on the 10th day. And I was good after that day. And about just before the 21st day to do the surgery, I started bleeding, hemorrhaging. I used the bathroom, took stool, and I was just passing blood. Clots, some blood was just coming out.
Yeah.
No pain, just blood just coming out. I ain't tell nobody nothing about it. I tried to drink a lot of fluid to flush it out. It's still coming. I have a daughter now. She lives with me. She's a nurse. So it so happened she come in and she see me bending over and she said, Mom, what happened to you? I said, girl, passing blood, I don't know where that blood coming from. Coming from the anus. She said, well, let me see what kind of blood you're passing. So when she looked, she said, nah, this is serious. Get ready, you're going to hospital. So I went to the hospital. I spent 2 nights in the hospital, and they had to do, they was doing a lot of blood tests. But what happened was, what the oncologist came in, what she said is, this is a side effect of the chemo, one of the side effects of the chemo. But it will pass away. It would, so I said, so how long again? Well, they gave me some injection and it really stopped it. So it stopped, and that was the last bleeding. I was good. I went in to do the second dose of chemo, and my blood and my white cells was very low. It was point something. You say, well, you can't do no chemo today. So that was the second dose of chemo I had to do. So they told me, well, you know, if you started drink some chicken foot soup and this and this, you know, they're telling you all kind of things that you can take to try to build your blood up.
Mm-hmm.
So I started taking Popoli because I know that has helped build up your white cells. I think that it shoot it up. When it's time for me to do the chemo, it dropped back. So when I went for the second chemo, it was too low again.
Okay.
So within that time, I started looking at, and now I have a schedule to work with. I'm looking at the time, it pushing me back.
Mm.
So I went to my doctor that during the time after the clinic, and I said, you know, I need to talk to one of the oncologists. So they put me onto this oncologist, very nice young lady. And she said, okay, Miss Edwards, tell me what's your problem. I say, there must be something that you could give me to build my blood up. There must be something. Go check your encyclopedia, check your nursing book, your doctor book.
Mm-hmm.
There must be something because I know I don't mind having the chemo. So my oncologist nurse is telling me, Verna, these are things you don't try to push because this is the Lord's work and you must not have it. I said, no, I make up my mind to have my chemo and I want to have it because I want to finish. If I'm taking it, I might as well finish it.
Mm-hmm.
Eventually, the doctor said, okay, we're going to give you, there's an injection that is give you have to take it same time every day. It just sting out my head, but I'm sure you will know what I'm speaking about. So you get it in your belly and it will carry up your white cells. Is it Rogram? I think it is.
Sorry, is there anybody on the call know what Verna is referring to? Because I can't think of.
No.
I think it's Rogram.
I can't remember if I have the same.
Maybe they use it in Trinidad. I don't
Yeah,
know.
but remember as well, the Caribbean use a lot of American drugs.
Oh, yeah. Yeah.
Oh, okay, but anyway, it really did work because you have to take. I got three. All right, so I got. She said, "Oh, what you do? We're gonna give you 6 doses. So you take three nights straight, and rest, and 3 nights before you're coming to do the next dose of chemo, you will take that." So when I went back, it went up to 1 point something. All right, no problem. You're strong. You have strong willpower and things. So we gave it. So I took it, and that is history. I was able to do my 4 dose of chemo. I finished my chemo in July. I was completed with all my doses of chemo, and I was good. I mean, your hair gone is no big thing. Your hair will go back. My hair started growing back within a 6 weeks period. My hair started to go back, and I said I'll keep it low. No patches or anything, just full growth come back. Nice hair. And I had to do the radiation now, but you're not trained that lay back. So when I went to St. James to do the radiation now, the machine is down. So now we're looking at the time. It's a month you're taking. So I am saying, I'm talking to the oncologist there, the radiologist, and I say, I need to get this thing done, I need to get this thing done, If I do it, I'm doing it. I want to do my full treatment and rock back and thing, I tell them that. It's okay. The machine was down, but anyway, it was back up and running, and I got my full 21 days, almost days of radiation.
Right.
I was good. And to be quite honest, I had no blackening of fingers, no blackening of tongue. The only thing I had was my hair loss.
Right.
I just had a little discoloration on the chest area with the radiation. Nothing to talk about. I see people come in and they real burn up on the arm, chest, and they show you it, and I said, wow. But I was using this. There was an ointment they told me that I could use, and that really worked. So I was good. And I went to the States. I was able to leave in November. So I went to the States in November, and I'm curious about this thing still. So I did a CT scan in Trinidad. They said they didn't see no reoccurrence of the disease. I said that sounds like good news. I went to the States. I did the PET CT scan, and you know the PET is more intense. So the PET ended up picking up something in the pectoral area.
Oh dear.
So I'm on Ameridex. They had me on Ameridex. So I'm taking this tablets and this thing. I can still feel when I play. I can play all right. I can train. I cannot play tennis good. But after, like when you lie down in the night, I will feel this, just not a sharp pain, but a kind of discomfort in my chest, just in my midsection there. To be quite honest, it never really put any stress on me because I say, this is something, I am not the first, I wouldn't be the last. And I
Okay.
take it as, and like my doctor was telling me, I was asking her, I said, give me a lifespan on this thing. She said, Vuna, let me tell you something. Don't ask me for no lifespan because this is not a life sentence. Treat it as if it is any ordinary sickness. You have hypertensive, people have hypertensive, people have sugar, diabetes, you might have a stroke, people have different things and they're surviving. So this is another thing, you have cancer, yes, it might kill you. You don't know if it will survive it, you don't know. But you have to live through it and don't stress yourself. And that was my mantra right through. I ain't stressing myself at all with it. So I did that. And when I came back, my doctor said, oops, you see something here. So you moved up. Now I'm stage 2. So I said, so, all right. So it moved from stage 2 to what? Stage what? He said, well,
3.
You look like a stage 3 to stage 4. So I said, oh.
Okay.
So hear me now. So this is death here now because people stage 3 to 4, almost to 4 is death you're talking about. And the doctor said, well, he want to say, it could happen and thing, but I say, you know what? I ride in the waves, I adventurous. I ride into this wave. I go in full throttle with it. He said, all right, but I tell you, you're no longer stage 2B. So I was stage 3. I think I was stage 4. So, all right, this is in 2018. I came back home 2018. I went back to the States in 2018. This around June, July month, and I said, you know what, I'll do another PET scan. I did a CT scan before I went in 2018. The CT scan in 2018, it ruled out no reoccurrence of the disease, no lymphedema, no. My hand hasn't swollen or anything like that.
There's
And I've
someone
been
playing
sick.
music in the
Yes,
background
no,
where you
somebody
can.
passed it.
Oh, music. Yeah, go on.
Let's try that. We have music all over the place.
Yeah, okay.
All right, but the car gone. Yeah, so I'm telling you now. So 2018, the CT scan is telling me I'm cleared. But how I'm feeling, I know it have something there still because I'm still feeling a discomfort. So I'm talking to a good friend of mine in the States who is also a survivor. And she said, you're not supposed to be getting no discomfort in that area, You're on Aramidex, you're on tablets. So, all right, I spent Christmas over there. I did it in December, and I started going back home in January. So I came back home in January 2019, and my doctor said, we don't like what we see, The PET scan is really intense. And if the PET scan picking it up, there's something is really there. So they see it was 0.4 millimeters at that time, and it went to 0.6. So he said we have thing for concern here. So they add me on to Fastodex now. This is an oil-based injection that you get. It's a double injection. When you get that injection, you're feeling. You had to take that. Normally, would take the time and insert it because it's oil-based. So it takes a time to go into the system, and it's so painful. So I had and you had to take it just as every 2 weeks. You had to take like if you're doing chemo. So I was on that. I got like 6 doses of that. And this is 2019. And so you see me on this Fasodex thing, I like it to know. They had to try something else. So I went back to the doctor and said, there's nothing else all they could try. So you know what? This you're progressing with the medication, so we need to take you off. So they took me off of both Ameridex and the Fasodex, which I say, thank God for Jesus. And they put me on, I am like a guinea pig now. So they put me on everolimus, which is Sotecan tablets, and aromacin. But because I'm HER2 negative, right? So they put me on these 2 tablets, and there's a challenge because I start taking it and I'm feeling good. The discomfort was getting is not there no more. So I took like about 4 boxes of that, and that was it. You can't get it. You don't have it in the system. But this I started to get anxiety attacks now. But I recognize as anxiety attacks because I start feeling this heaviness in my throat, and it's like a can't breathe. And I'm saying, oh Lord, I wonder if it's a stroke I get in, boy. This kind of feeling, it ain't right. So I went to my GP and he said, Verna, listen, it ain't had nothing to do with no stroke or nothing here. Because I had a stroke like how much years ago? This is 16 years ago. It was a minor stroke, wasn't nothing big to talk about. So he said, don't worry about that. Is anxiety attacks, and this is the reason why it's feeling like that, because you're not getting medication, so you feel that you can progress again. So anyway, I am on 10 milligram Sotecan, 10 milligram, 25 milligram of aromacin. So I'm going on good again the aromacin, but you can't take it without that because it work in tandem to one another. So I have this whole 2 boxes of aromacin and no Sotecan. So I am back and forth. So I went to the pharmacist. I said, listen, the what do you call it? The virus stepping now, right? So limited stuff coming into the country. So I said I will write. I told it the doctor said I'm going to write to the Minister of Health because we can't have people who give so much to the health sector and suffering with this thing. It's ridiculous. I have a lot of people dying because of that. So I said, all right, when they realized I was serious, I said, I will write him and tell him that I need to get my tablet. I didn't write him, but whatever the doctor do, the consultant said, this is serious business for now. And we need to take a stand because they're seeing some improvement. So whatever they do, and I started getting it. So he told me, you know what you're going to do? We're going to keep you on the 10 milligrams of this Sotecan, but I want you to take just 5 milligrams so that you will always have. So I now I'm getting it regular. Every time I go, I call, yes, it have come in, you get it. Yeah, I'm getting my regular supply, but I'm in Trinidad now because you can't travel as you want. It so happened that I'm having it. I did my CT scan. My CT scan, it cleared me again. But this time I feel much better because I'm not getting that discomfort with this new medication. So something got to be working. So they have seen, the doctor told me the last CT scan I did was in Oliers last year. So I didn't get the results, and now we don't get results here for CT results 3-4 months down the road. By that time, I went and said, but people get dead here before they can really see if your medication working. Anyway, eventually, I got the results in March, and they have seen a reduction on the whatever tumor, whatever it is, but I'm not getting that discomfort anymore. So now the anxiety attacks has eased up. It's not as rapid as it used to be. I'm more comfortable now, no pain, no discomfort. Except for sometime when you try to overdo it, I might lift something a little too heavy, and it's in my chest area there, so it's in the muscle now.
Right.
But the muscles, because of how I'm using that area regular, the bands inside there is very thick.
Yeah.
So it's not penetrate. It's not really where it is. You know that muscles, that lumbar area muscles, it's their bands are twisted muscles, right?
Mhm.
So it is somewhere inside there, but it's not penetrating the walls anymore because it whatever the medication is doing, it reducing the thing. So it's not pressing against my chest walls anymore.
Okay,
But
very good.
it might still be in my muscles, you know. But I want to do a PET scan, but I had to wait until the borders open up to go to the States and do my PET scan, where my mind will be more at ease because the PET scan really giving you a better result, a more precise thing. It goes deep. I can pick up everything, and it's better for me because the CT scan and all my veins with this chemo, it has, you know, it hard and rubbery, and it's, you know, for you to do the CT scan with contrast, it had to go through your veins, so it's really painful at times. So that is my story there. I still on a
Okay.
certificate.
Thank you very much,
Thank you.
Verna.
Yes.
I think I'm glad to hear you in a lot less discomfort. And we're going to come to Cheryl in a minute to talk about her story. And I'm sure there'll be a few people have a few questions as well about anything Verna has just said. Just one thing I want to ask Verna before we ask anyone if they have a question to you and go to Cheryl. You keep saying you need to go to the States to have a PET scan. Do they not do PET scans in Trinidad?
Well, they at the time they didn't have it. A private company has just brought it in just about 6 months ago. And when I call and inquire about it, it's like $15,000 to do a PET scan, which is really, really, really high. When I'm doing a PET scan in the US for like 700 US.
Wow.
Monks of the same thing.
Wow.
Monks of the Delhi, the same thing, you know.
No. It's 7 to 1. It's 15 you're talking about. It's not 1,000 US are using.
Okay.
700 US. So you see the
Right.
You said
difference. I mean, if I
16,000.
15,000 Trinidad
15,000
and
TT,
Tobago dollars. And you
which
say
is
that you can't get a PET scan basically in the public hospital. You have to pay for
no,
it.
no,
None.
no. It's not available in the public hospital. They don't have
Right.
those machines. But I understand. I heard the minister said that they are preparing these new hospitals that they building. The San Grande Hospital and the Arima Hospital that is now under construction. They're going to have these new machines installed
Right.
for cancer patients, PET scan. So that is when how much people done dead and gone already.
Yes. Yes.
Yeah,
Okay.
so
Too right. So we'll come back about support and everything in a minute. Does
yeah.
anyone have any specific questions for Verna now about her story? No, Caroline?
Um,
Oh,
Jeanette?
well, what I what I would like to know is that during the time she was having all these different treatment, was it they were just doing the treatment and not having to check regularly to see if it's working?
Yes, during the treatment, well, before the treatment, I was doing the cancer marker test and you have to do a blood test every time before you do the treatment, right? I think that's standard. So after the test, after the chemo and the radiation is when they will send you to do the CT scan. The CT scan, I did a CT scan, I did an echo because that is in the chest area. I did CT scan and the echo, and then another one that they do like a stress test kind of thing to test it, check. They did that, but that was only done after the complete treatment, which is 8 dosage. I don't know
And
how
they didn't do a mammogram
Oh yeah,
towards
well,
the
okay,
end.
yeah, all right, okay. Sorry about that. I did yes, I had to do actually I have to do I had to do a mammogram after. The mammogram clear it up. They didn't see anything because I did full removal lymph nodes. I did all the lymph node removal and the full mastectomy. I had to do a mammogram. Actually, I'm supposed to do another mammogram by now, and well, October month. I normally would do it in October, so I have to do another mammogram by the end of this month. You know?
Thank you.
Yeah.
Thank
So
you. You're
I'm
very brave.
Well, that's
Yeah.
what people say. You're
Very
brave
brave.
and you're
Very
brave and
brave.
strong. But you
Yes.
know, when you have, I
Yeah.
had this friend. I had to go in with her, and when you see, I work at a psychiatric hospital, and I remember very young in the game when I went into nursing, there were a patient on the ward without a breast, and it was so alarming to me. First time I saw somebody without breast, and I was like, "What happened to this cancer?" They say yes, and I remember seeing a woman. She went through.
Someone's phone is going off.
Yeah,
Yeah.
sorry. I tried. Let me.
What?
Yeah, I have called. Yes. So
Mm.
you see people go through things and you tell them, to be strong, but only when it hit home, you have to realize how strong can you be? How strong can someone be? And then I realized, I see, you know what? If you telling people to be strong and you can't be strong, it defeats the purpose of telling people to be strong.
Yes,
Even if it's lip service,
yes,
you
yes,
know, you have to somehow project that strength, outward strength, to be able to see. Because when I go to clinic, I am always telling people, it's okay, man, everything will be all right. Even with my friend here, Cheryl, I always ask Cheryl, have you been to do you went and do your checkup? And every time that come up, I go leave me alone. And I said, no, you have to go and do your checkup here. Your checkup is important. That is how you can know if everything working.
yes, yes. So Verna, let's come. I'm sorry. If does anyone have any other urgent question? Because I want to move on to Cheryl to hear Cheryl's story and her journey. Anyone else have any urgent questions for Verna now?
No.
No. Okay, we may come for a wrap up at the end. So Cheryl, hearing Verna's story,
You go.
tell us about you. Where did your journey start? How did it start? How did you first become concerned about your diagnosis, and what was your treatment pathway like?
Okay, well, I started in 2012,
Mm-hmm.
noticing the lump and decided,
All right, here.
yeah, this feeling funny or looking funny. So
Mm-hmm.
I went to my doctor and he said, how long you have this? I was like, I really don't know, but it hurting me now.
Mm-hmm.
Oh dear.
Yeah, so he said, okay, we will work on that. So we did a biopsy. He removed it, sent it to check. It came back in about a week. He said
Okay.
it's cancerous.
Okay.
I said, all right. I said, so what now? He said, well, I'll send you to St. James. That happened on Friday. No, I think on Wednesday. And they'd normally do that. So I had to go back on Monday and end up joining the clinic. Went into Dr. Rodriguez and with the breast cancer.
Mm-hmm.
They said, well, you know what? We're going to start up with chemo because we don't want to really wait. And I had, jumping it, I had like about 8 chemo,
Mm-hmm.
so they're telling you that when you do your
Wow.
chemo, what will happen? So they tried to shrink it because when he took it, when he removed it, it grew back, like
Okay.
another one pop up.
Okay.
Wow.
So they said, well, here, what we'll try to reduce the chemo, the lump, sorry, and then we will check the operation. So we did
Was
some
surgery
chemo.
not discussed at that time? No.
No, we wanted to reduce the lump first, then we will do the surgery.
Okay.
So we had the chemo. Like when I say my chemo wasn't good at all, I felt so sick.
Mm.
As you eat, you have to bring it back up.
Mm-hmm.
I say, wow, what am I supposed to do? I am hungry.
Mm-hmm.
So, somebody said, look here, what? Eat. And when you bring it up, you'll be all right after that. So I had to try that. And it really did work for me. So I know when I eat, just eat something. Don't eat much. Just eat something to get rid of that feeling and you'll be all right. Well, we did the chemo, hair drop, I had to go to work.
Mm-hmm.
I was as maga as a macaroni.
Right.
Everybody looking at you and is like, what happened to Rezi? And well, I told them, well, look, I was diagnosed with cancer, so I have
Okay.
to do stuff. And they realized, and everybody's like, she had cancer, you know, she had cancer. The whole of the ministry
Mm,
knew that, you know, it was diagnosed with breast cancer. So,
mm,
well, all right, we did the chemo, finish. And like Verna was saying, you had to bring up your blood before you go for this chemo. I am being honest, I can't remember the name of the injection,
mm-hmm.
but when you give you that injection, it finds every piece of marrow you have in your body.
Oh, dear.
If it's the last piece you have in your waist to go wrong in the nighttime, it taking it.
Mm,
That just, it going into all your joints and it's pain. Ooh, that was the worst part of my chemo, that injection. But anyway, you had to bring up your blood. So when you take that injection, it brought up your blood to the limit that they wanted.
mm-hmm.
So you got your chemos. Right, chemo finished. They say surgery just before Christmas. I think it was the 19th of December. And I have my 2 sons were down here, and my daughter. They didn't know how. I mean, they're not very young, but still they're not accustomed to this being within a member of the family. So they take it a little uncomfortable and hard because mommy is the one to do everything. Everything is for mommy. So when we did the surgery, the 19, I was in St. James.
Yeah.
Came out, they removed, they did a complete mastectomy, and I think the lymph nodes. I said, don't take all because I am an athlete. I need to do my shot put. You know, I'm begging for my arm. So he
Mm-hmm.
said, well, all right, we will just, you know, remove a few, but we'll try to get off most of the cancers that are attached to it.
Mm-hmm.
And after that, I had to do radiation too. But I only got about five radiation sessions. But according to when I didn't get black, my nails didn't get black, my toenails, you know, your feet, your tongue, all I know, I had no hair.
Okay.
None, none. And
Mm-hmm.
other than that, I'm okay now. I don't follow up on my treatment. I am sorry. Or I am just what do you say, a delinquent.
But why is that, Cheryl? Why?
Because my last treatment, the tablets, the Amoredics, I think I was taking that. No, I was taking finish, and then they put me onto something else. And I was feeling real sick, serious. So I went back to them and tell them, this not working with me. I'm not feeling well.
Mm-hmm.
So they said, all right, we wouldn't give you this. You will come back when we get the Amer. And I really never went back. I went to my private doctor, you know, I let him do my check. I did a CT scan, and it was okay. So I was feeling that, well, I'm all right, hoping, just praying, you know, doing my little herbs. I don't really drink. I don't eat meat, no meat. I just do a little fish. No dairy products. Milk, cheese, butter, no dairy, none.
Okay.
And that's it for me.
Right. I see.
I
So,
still,
Cheryl,
yes, sir.
we'll come to support generally in a minute because thank you for sharing that story as well. Is there anyone has a question for Cheryl?
How long ago did Cheryl have her diagnosis?
2012.
2012. Yeah.
And when did you finish with your radiotherapy and chemo? What
Radiation.
year?
That was in 2012, sir, because everything was done in December. So it might
Okay,
have come over to the January. But more or less, you know, wasn't much. It was just 5 sessions.
And was it a lump that you saw, Cheryl?
Yeah, yes.
The reason why I'm asking that is because I I didn't share with people that my sister died 5 years ago from breast cancer. And it wasn't a lump, it was just, they saw shadow.
Oh,
And when they did the scan and so, then they realized it was hormonal.
wow.
So that was developing into cancer. So that's why I
Oh,
was asking you if it's a lump.
yeah, it was a lump.
Because I think with the lump, we'll be able to pick it up quicker. She died
Mhm.
5 years ago now.
Right. Okay. Anyone else have any questions for Cheryl? And then we'll move on to the aftercare report. Cheryl, I know you are not for. Sorry, Caroline, I can't see how to mute all on this. I'm not.
No, I was just going to say that if people are not speaking, that if they should just mute, and then
Yes.
that way, when you want
Yes,
to ask
please.
a question, if you unmute. So if everybody could go on mute, it will prevent any background noises that might
Yes,
be
please.
coming.
Yes, hi, and welcome to Vashti and Suzanne, who has just joined the call. You all have missed Cheryl and Verna's story, and Michaeline has joined us as well. Okay, so Verna, you clearly are very resourceful, and you do your thing. You visit Dr. Google, and you do your research, and you do all these sort of things. But there will be many people, of course, who don't have the resources, the money to go to America to do all these sort of things. My question is, what structured support is there for breast cancer sufferers in Trinidad and Tobago?
Okay, well, I could sort of say something on that. I am at the Sandy Grande Clinic, right? And we do have an aftercare because they will come in after you have completed your treatment. We have a kind of patient kind of aftercare. People will come in and will talk about how they feel, talk about the treatment. Some people will be very emotional and
Who's
stuff like
running
that.
that group, Verna? Who is running it?
The oncology clinic. The
Is
nurses
it a
from the
doctor, a nurse, a
yeah,
therapist?
yes, we have well, the clinic is not functioning now due to the pandemic and stuff, but
Okay.
while it was functioning, we had the doctors, the oncologist doctors will come in, we had a social worker will come in, and we had nurses will come in, and then we had patients who surviving patients will come in, and they will talk about their survival route stuff,
Okay.
and we have I think I don't know if it's like that in Port of Spain, but in Sandy Grande, and you have anytime you miss your clinic, they will call you.
Okay.
Because my doctor met me at the mall at one mall one time, and she said, Verna, and this had me so surprised because you come in as a patient and you come in, you see a doctor and they attend to you, and you're gone. It's okay.
Yeah.
They will see you when they come back to the clinic. But
Yeah.
I remember I was at this mall, and this person clapping. When I look, I say, "Who me you calling?" She said, "Yeah, you." She was one of the doctors at the oncology clinic, and she said, and they call. The nice thing about it, they will call you by your name. They call you Miss Edwards or Miss Reyes, so it have a kind of family kind of connection. They say when they come in, they remember everybody, even though you have on mask, which is surprising. I say, you make me out under my mask? She said, of course I can't miss you under your mask. She said, I hope you make sure and stick with the clinic date. We don't want you falling through the cracks.
Right.
And just that is what had me. I say, you know what? Let me stick, because I hear people say they come to the clinic. You can't take on that clinic now. You just come there whole day and you sit down. You spend 3 hours, and when you go to the doctor, you spend a half a minute and you're out. So I just make sure I get my clinic date. They had me, after I finished, I was on a month break. I used to go every month. And then when they picked it up, they put me on 3 months. And then when they picked it up, they said, no, we want you here every week. So I said, well, they want me here every week for? Because we want to make sure everything is good. We use one of our model patients, because I'm always so chatty when I come in. I tell them, I say, well, they see this cancer is taking me down. I fighting it hard, I just tell them, patient them that I say, don't give up, Don't give up. They don't only worry, and then, this cancer won that. Glad for that. Glad to hold on to stress. You know, those stress on yourself for. I tell Cheryl that too. Don't play stressing. Just do your travel. You had to go here and you go there. We both of us work together in track and field,
Right.
and that she's like, I her support and she's my support kind of thing. Because if I hear anybody say anything about Cheryl, I ready to fight them. I say, hey, don't talk to because people don't understand people's feelings, and you know you feel like you tell somebody something, you have cancer, you know, that kind of thing, and they tend to do that small talk at people, and they don't understand people's feelings. Simple things like that can put people in a corner and say, boy, I remember coming out here and I said, boy, the first time I came out of track and field, after I did my treatment, I had a whole year treatment. So the next year when I came, I wasn't seen in 2017 at all. And the mere fact, you feel there's a sign on your face say, I have cancer.
Mm.
You know, you feel it's like a pride thing. Everybody look at you and say, oh, she had cancer. That's why she must be looking so, you know, nobody will say she had diabetes or she has something else. They will say I had cancer. So it's a kind of taboo thing.
And how did that make you feel, Verna, when you heard those small talk and so on in Trinidad culture?
Well, I am the kind of person that will hit it head on. I'm going at you. One time, I remember this my other friend who had the cancer. We worked together, and that before I had it, and I remember this other staff telling her, everything for you. Anytime you can't do anything, it's because of the cancer. So I had to pull up one time. I said, hey, you don't know what you will get. You don't deal with people like that. And today, me and she don't really talk much, and she was a good friend of mine because
Really?
and I talked to her today and all. I say, how you going? She good. I said, no, you know, you had to understand people and understand people's feelings, understand people who ill. Put yourself, have some kind of empathy for people. It's not that you're going to, I just tell them, I say, they don't feel sorry for me, eh? I don't want no sympathy from nobody. I had cancer, I deal with my cancer, I do my treatment and things are good. Though when they see you, oh, governor, come. You good? You all right? How you feeling?
Yeah.
You know, that kind of pitiful kind of thing. Deal with Verna, how you accustomed dealing with Verna.
Sorry, Caroline has a hand up.
I was just going to say that made me think about when you said about how people treat each other. It made me think about kindness and empathy, because that was something that we've been talking about around World Mental Health Day and just generally, and we were talking about in terms of mental kindness and empathy can go a long way. You know, we need it in life, and that's what it just made me think about. And we have a recording that we've done that's on the Tough website that it might be interesting for you to have a look at and share as well. Among some plugging it, but because I think we can't underestimate it. And I know most of the people on this call are nurses or you know we are work in healthcare. So I think it's something that I think we need to probably push a bit more in terms of that kindness and empathy, because obviously, you know, these are other people in healthcare who are probably not being as empathic or kind.
Yeah, I sent a video to Cheryl actually. Cheryl, you can share it with Verna. But Cheryl, Verna is someone who goes at people. What about you? What was your experience, lived experience like when people were maybe making comments about your illness?
No, well, most of the time, you know, they'll be looking at you. If you're coming to them and they're watching your breasts, they're watching to see if it's left or right. I say, don't worry. I say, it's the right. Focus on the right.
Wow.
Honestly.
Yes, serious. They're actually looking at you, you know, just to find out. I wonder which one she take off.
Honestly.
You know,
Wow.
it was so petty. It's real petty down here.
Well, it's something we have to consider in terms of the Trinidad and Tobago culture. What apart from educating people, what else can help? Because I mean, two of you may be strong women, but there may be other people who these things can get them down. Maybe,
Yeah, of course.
you know, colleagues making, or even family members. Or,
Because let me say something. I had a friend, she has breast cancer too. And in fact, both of them, their husbands left them.
because of their illness?
Yes, because they're missing a breast. Serious.
Yeah.
After so many years of
But that
marriage.
happens, you know, that
It
happens.
happens, yeah, it happens, it happens.
Walk away, you know.
Yeah, it happens. Well, I have some siblings, and one of my very close siblings, he one time just after, while I was going through my treatment and stuff, he came one day and he said, onesie. So I pull him up one time. I said, hey,
Mm,
Oh dear.
ain't got no onesie with me. If you look, you see I had two breasts here. So it
wow.
ain't had no onesie. But
Now your son.
that's my brother.
Your brother?
No, my son and them would make fun. Which one it is? Let me play with this one, you know, that kind of thing. But yeah, I have a good support base, very good. I have two little grandchildren at home at me. One is 4 and one is 6. And those kids, man, every time I go to clinic, Granny, where you going today? I said, I'm going to clinic. You going clinic? The little one will say, tell them to put back on your breast, all right?
Ah.
Oh,
I say, all right. They will put it back on for me, right? So the big one will say, no, Granny, don't want the breast on because it was spoiled. It wasn't good. You know, so she explained it to her now, but she can't understand. Say, Granny, your breast not good. Why they cut? Why they take off all the? Why you couldn't leave a little something? I said, no, I don't want it. It's not good. They take it off. It's all right. So they grow to understand now. So
okay. So can I ask both of you, is
Mhm.
reconstruction surgery part of a treatment option in Trinidad and Tobago?
Yes.
Yes, it is.
It's
So
up to you.
how does it work? And did it
Expensive.
apply to you all, or?
It apply to everybody, but
Well,
it's if you want it.
Well, I'll tell you in my case, when I was going to do my surgery, the doctor gave me the options. He brought this thing to me, said we could do the construction one time.
Yeah.
So they
Mhm.
want to put on this expander, and after how much weeks or months, they will take it off and they will do the reconstruction. So I am telling them I don't want anything on
Okay.
because I see people who put
And
in expanders,
had to take off the next one.
and it I don't know if
Went across.
it infect the right side, or it infect the left side, and I mean, and then I have seen people take off the take it off because of the expander on one side and put in faults on the next side. And I told him, I said, I'm good. I went to Nostrum in the States, and they're quite professional. They will measure you, and they will weigh one of the free breast. What I did was I did breast reduction on the other one
Mhm.
and removal on the other one, right? So when you go, what they're doing at Nostrum is they're very, 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 very professional. I was telling Cheryl if she could have done that, it would be good. They weigh the existing breast, and they measure you, and they could tell you, they'll give you the exact weight breast to balance off your back, to balance you. Because when I after surgery, I went and get this cup, and it was so light, it had you walking one-sided.
Okay.
So, but once you get your correct weight, when you put in that cup, nobody could see which one it is. It's so real. It has like a nip. The prosthesis is so real, and it have the correct weight on both sides, so it
Right,
balances
right,
you
right.
off. You know, and I have a lot of movement from right to left, and it does shift.
Okay.
It have a suction in the bra and will like attach,
That's good.
and it makes you feel as if it's your own, you know. So I not gonna do. I don't want that option to put, you know.
Press it. Okay. Fine. Alison, you want to ask something?
Yes, I wanted to ask both ladies what follow-up or what checks are they doing on for your good side to see
The good
whether
side,
anything's
I'm just doing mammogram
Yeah.
and ultrasound.
okay.
Yeah.
Ultrasound and mammogram, I like every 6 months or once a year. And if they see anything, they will tell you do it twice. But I I only did it like once a year.
Okay.
Same apply.
The doctor told me I don't need to do it because after you do it twice for the year, 2016, 2017, 2018, twice for the year, like 6 months, 6 months, and they see nothing is going on in
No
that.
changes there.
Yeah, they tell you just do it once a year. So you do
Okay.
ultrasound, you do the ultrasound and the mammogram.
That's good.
So you could keep checks on it, and it's been going
Good.
good so far. And I think because we have been both
1 minute.
athletes, yeah, because we have been both athletes, former athletes, there's something in the genes there that is probably,
Keep you, yeah.
keeping
Keeping
us.
you fit. Yes, it's
Keeping,
important.
yes,
Caroline?
yes.
No, I was just gonna ask if that was both of you. You both do your ultrasounds and mammograms on a yearly basis. And
Yes.
and I suppose, that's the thing in terms of diet and exercise,
Yeah.
your lifestyle and that
Mhm.
sort of thing, does have a
Mhm.
part to play, I think, in
Yes,
our
of
overall
course.
health and
Yes.
well-being and the way we're able
Cheryl,
to
you're out of the
recover.
picture.
And I see myself.
So I'm conscious of the time and we want to wrap up and ask people other questions. But for both of you, in summary, has your I know you both are athletes and you still go and represent the country in Masters games and so on. But would you say your overall lifestyle, whether it be exercise, whether it be diet, whether it be friendships, relationships, whatever, has it changed much since your diagnosis and treatment?
Well, for me, I'll talk first. For me, it has changed about 25%. It has changed. Have become more conscious of a lot of things. You go out there and you want to know what it is you're eating, what it have in that. Before I would not have been that conscious, but I'm more conscious now than before. Even with friendships, you talk to people and you try to figure out how they want to think about you. So
Okay.
it make you change. It change it have a change, but otherwise, sporting wise, I coach at the University of the West Indies, and um, at one time while I was doing treatment, I had some athletes because I do table tennis, and my athletes were preparing for intercampus games, and there were a particular boy, a male athlete. He every time he will come, he will want to take my bag. He will take my bag out of the car for me, and he will want to put up the tables. Everything he said, coach, no, it's okay, it's okay. So people, a lot of people have empathy for you, and it make you aware of how people think about you, and it's different. It's not like before, you will come and you will walk in a hall and people will just be sitting there and anything. But when you with them knowing that you have cancer, if I go into a meeting, you will find people will be glued and they will stand up and say, for now, everything all right? And then, yes, I'm here. Everybody's okay. I'm
Really?
just,
So you feel like the microscope is on you?
Yeah, it makes you feel, like that,
Right. And Cheryl, what about you? Have you changed in any way?
Well, just the diet. I mean, I was already into no meats before the cancer.
Mm-hmm.
And when people heard that I got cancer, will you not eat no meat? How that happened to you? You just, you don't eat this, you don't do that, you do, and you're exercising. And it's like, wow, I gotta check myself. I said, that's right.
Mm-hmm.
That's right. But I mean, friends, everybody who died, who haven't died, sorry, and who moved away and everybody finished working and whatnot. But
Yes, yeah.
so it's just my sporting people that I have and my
You
gift
have
to give
around
here.
you, and that support
Yes.
network. Are you do you go to the support? You don't go to the support clinic in Grandy that
No, if we're not, no. You will have to be a member of that.
she no,
you don't live in the catchment area, is it?
we live not
Close,
too
not
far. We live
close.
at Rima, same catchment area, but I don't know what make her go into Pottersfield to do that. Probably
No,
she didn't
no,
know about
no,
Grandy.
no.
You went Pottersfield.
No, my doctor was in town, so he just sent me St. James.
Okay.
Yeah.
Oh, I see. I see.
Yeah, my doctor sent me St. James to buy. I told the doctor I wanted a referral to go to Sandy Grandy.
Oh, I see. I see.
Yeah,
I
I
see.
wanted to go there
Okay,
because
listen, we've got a few people on the call. Who would like to add, before we start wrapping up, I find this has been such an engaging educational session. Anybody on the call would like to make a comment, ask a question, give some advice? We've heard so much, and there's so much we could carry on talking for such a long time again, but anyone wants to say anything or ask anything?
I just wanted to say, thanks, and I commend the two ladies so much for their positive attitude, because it reminds me so much of my mother. My mother was exactly the same, and she fought breast cancer for 20 years. Yes. And she used to say, I am not ready to go. I have a mission. I have things to do.
Right.
And she would fight it all the way. She had, a few ups and downs, but I used to really, really applaud her for her fight. And I feel the same about these two ladies, Verna and Cheryl. They're quite remarkable.
I agree. Thanks.
And they always say, the attitude, your attitude and mindset is half the battle. And I wish more people would think like them, like you ladies.
Yes. Particularly in the Trinidad and Tobago context, with picong and fatigue.
I know, and they treat you as if everything is your fault.
Yes.
Trinidadian. There is still a big stigma, isn't it?
Yeah, but there's a stigma here too, There's a stigma here too.
Yeah, but I don't know.
Especially cultural. There's cultural link up to it here too, Roger.
Oh yeah, but in
there's a stigma here too. People try to keep it a secret.
Okay, well,
they try to keep it a secret.
Maybe, but I think over the last 30 years, the stigma attached to cancer in the UK, in my view, may be different. I'm talking about the UK, not cultures within the UK, like on the TV and the radio and people talk about it because
that's true.
There's more open dialogue about it. Whereas in Trinidad and Tobago, even from what Cheryl and Verna were saying, there's still a mystique about it. Still, as you say, people watching your breast to see,
which side,
and they're curious. They want to know if you have some sort of something that
we have inside.
Like you have an
Oh, before you all go, let me give you a joke.
Yeah.
When I did the mastectomy, I mean, I want to look hotter. So I went to the market. One side missing. So I put a brand new socks, white. any part. And I have on this nice cut vest, white. So I'm buying my goods. How much it is? And I bend down to put the plantain in the bag. Socks decide to roll out. And went tumbling.
You pick up yourself.
But as down here now looking, I said, Lord, you better go underneath that table,
Wow.
The socks roll out.
Oh, dear.
I just straightened back because I had on one of those bra that, with the stiff cup. So it didn't fall back. It didn't fall down. It stayed up. Just went pick up my socks, straight in my market bag. That was the end of the market, I'm done shop. Home time.
Roger, I would like to say thank you two ladies for sharing.
You're welcome.
Yes.
You are very good examples. Thank you for sharing.
I think
You're
so
welcome.
much, and I think Verna and Cheryl, we organize this. We're international. It would be so great. I don't know if there's similar things in Trinidad and Tobago where you can have a platform, other people sharing their stories and those
good.
platforms exist in Trinidad and Tobago.
This was good.
Maybe on radio or TV, can you all go and talk about your stories there?
Not really.
We still have a kind of blockage where that is concerned because nobody ever really it's not like advertised like how you get onto Cheryl and Cheryl asked me. I was saying, Cheryl, this is something a lot of people don't know, but so you're still you don't mind doing it, but it's nothing that you're not ready to come out yet. Because
in your closet.
Yeah, I am an international athlete, and a lot of people don't know. Who know? You know, but
Right.
you coming on the TV now it's a big open forum. You can say the whole of Trinidad will know.
Yeah.
If they see you in Toko, they might say, "Oh, that the woman with the cancer." If they see
Yeah.
you, so they
Right.
say, "Oh, that the woman was on TV with the cancer." You
Yeah,
know that
yeah,
kind of
yeah.
thing. So it's something we're not really prepared for or ready for yet.
Yeah.
You know that
Right.
kind of thing.
I
So
understand.
that's one of
Yes,
my
I don't think
reasons
we're
why.
ready.
Yeah, but no, but it's articulately put, and it's something that, you know, it through education, because, you know, attitudes can change over time. You know,
Oh,
you
yes,
Yeah,
yes,
change,
yes.
true.
because we don't get to where we are overnight. It's due to
No.
history and culture and all these sort of
Okay,
things
will you go on the
gradually.
TV? You go
Sorry?
If
TV?
you go in,
She going if I go in.
yeah, we
Well, I
understand
tell
that, Pierre.
you.
You
No,
know.
I think you make a great team, and I think
Great,
Yeah,
it's
yeah.
great,
great. I think it's great. You're very
Sharing is
articulate.
great
Wonderful.
You're
now.
very
Thank
very
you so
good,
much.
Yes,
very
yes. I
good.
enjoyed this session. So finally, before we wrap up, any final questions? I just want to make sure people feel so. Okay, so thank you, Cheryl Werner, for your time and sharing with us. It's been fabulous, educational, remarkable. Thank you all for dialing in on your time. We're late now in the UK. We're now minutes to 11 at night.
Let me ask you, can I ask you one thing
Yes,
with
of course, Werner.
Roger? I remember seeing on the advert where it's going to be aired today and sometime in November. Is it going to be on still? It will be 6th of November or something like that?
No, this recording, this will be you mean this recording?
Yeah.
No, this recording we will put it on our YouTube channel, and then I'll share it with Cheryl, and you can send it to all your friends. So you can use
Okay.
it as so people can
Okay.
repeat this and watch it at their own time.
All right.
Okay,
So
good.
yeah. Okay.
That's what it means.
Yeah.
Yes, it was
So,
nice.
so
It was
thank you for your
nice
time.
taking.
Lovely. Thank you
It was
very much.
nice
Cheryl,
seeing.
I
It
will be
was
in
nice
touch.
being
Werner,
with
Nice,
you
lovely
nice,
to
guys.
meet you.
Allison,
Nice to meet
Everyone,
you.
Tara.
Nice to
yeah,
meet you.
take
Thank,
care.
and
Yes,
thanks.
thank you.
Thank you.
You're welcome.
Yeah, bye.
All
Okay,
right.
have a good
Bye-bye.
night.
Enjoy your
Bye.
night.
Bye. Bye.